Good morning. So Quintiles, who are we? 26,000 people in 60 countries. We're a company you've never heard of unless you happen to be a customer of ours, probably. We service the healthcare and biopharmaceutical industries, and what we do is we provide business services to help speed the production, the development of medicines, and also to try to improve patient outcomes, clinical outcomes in a healthcare setting. IT at Quintiles has had a storied history. The company is 30 years old. I joined the company 7 years ago, and I'm just going to share some of the learnings along the way and some insight into some of the things that we've done to try to make IT a game changer. So by the numbers, let's talk about where we are right now. Today, right now, this year, we've generated in excess of $40 million of net new business directly from activities that the IT group carries out. So these are products that we've built that we offer to our customers that they pay for. So we feel pretty good about that because that was from a standing start of zero towards the middle point of last year when we started to launch our first game changer products. The better story here, though, is the $400 million of business service wins that have been directly enabled by products that the IT group has created. Now, these products, we like to call them game changers. Very interesting fact here is what we've seen when these game changers come onto the field and are offered to our customers is that our strike rate in RFPs for work has more than doubled. So our sales organization is pretty jazzed around that. And what I'll do today is share with you one of the game changers that we're bringing through right now. It was launched earlier on this year, and it's actually a co-development with one of our key customers, Eli Lilly. And it was 3 years in the making. It comprises facilities, infrastructure, people, medics, researchers, and an awful lot of data. So what I'd like to do now is just to share a short video, let the team talk about it themselves, and then I'll offer some insight off the back of that. So if we could run the video, please.
Most planning and design, at least in the large pharma customers, is done by teams of experts, subject matter experts, physicians, clinical pharmacologists, health economists, statisticians. And they get together and come up with the scientific design of a program, what endpoints are needed to demonstrate efficacy or benefits for people, what safety risks are involved. So the design predicts the outcomes. Your scientific design predicts your clinical outcomes. Your operational design, your operational plan tells you how the trial is going to be executed. By using data and combining it with expertise, it can lead to much better planning. It also allows you to do different scenarios in the planning process so you can better understand the trade-offs between time, cost, and risk.
This is our innovative, facilitated, interactive, computer-assisted design platform.
It's real data for real patients and real investigators.
It allows us an opportunity to digitally capture and centralize design thinking.
All the different functional representation is kept in one place, in one language, in one visualization.
The platform is leveraged in a group setting in which we bring together the scientific and the operational design experts.
Interactivity of that data across all the different parts of the platform allow for a lot of really great discussions to happen, not only at the CRO level, but at the sponsor level simultaneously.
So this platform allows for real-time analysis of large volumes of electronic health record data.
And it also uses Quintiles' wealth of data, which goes back 30 plus years or more, so that we can actually take experience from our clinical trials with several different sponsors in any different indication, covering areas of regulatory, site startup, and patient performance.
It allows our customers to create and compare multiple design scenarios.
So that everybody in the room and all the different functionaries can see their piece, and they can see how their piece affects other pieces of the puzzle of planning and design.
In one day, and in one sitting, and in one workshop session.
Customers absolutely love it. Not only do they love the functionality and how it's interchained between all the different aspects from schedule events all the way to schema, visit scheduling, and labs, but the experience itself, I think, raises so many questions and drives so many great discussions.
We help them to trade off decisions, to focus on those key parameters of cost, time, risk, and ultimately the probability of technical success.
The biggest net gain for our customers is predictability of outcomes, improved probability of success, and more confidence in the decisions that they have to make. The benefit for patients is that they will have new medicines faster that are going to be safer and more effective, or that meet unmet medical need.
So it has a code name, Semio. Semio has been the working name for that game changer for the last 3 years. And Semio addresses a major pain point for pharmaceutical organizations, but it actually addresses a much bigger societal problem, which is around how to develop the best plan, create the best design in terms of bringing a drug through from research all the way through to a doctor that would prescribe it for the right patient population. So we've spent a lot of time and energy working through mountains of medical record type data to get to this point and to create this game changer. And we like to think in Quintiles that by standing way back, we see the bigger problem, and that's what we try to solve. And we've had 3 game changers so far in our 7 years of trying to get into this. So 7 years ago, Quintiles IT was a service organization. Our core metric was DNFIU. Do not forget its uptime. I'm sure some of you think it stands for something else. But at that point in time, it was as much as we could do to send email, to keep the network up, and just basically to keep the lights on. It absolutely consumed us. So we did 2 things. The first thing we did is looked at the culture of the group. What's the quickest way to change culture? Change the leadership. So we did. Next thing we looked at was the team. We had some great people. Had one guy, Joe Donacy, working in Kansas City, had 5 people working for him in a support team. He now, today, works directly for me, has 400 people working for him, runs all of our data centers, networks, and what we call core IT. My colleague, who's just over here, Gavin Nichols, 7 years ago, Gavin was running a support team in Edinburgh, Scotland, for one of our business units. Gavin today runs our research and development technology unit, which is responsible for what you just saw as Semio. So we developed a belief that we could do this, that we could actually move from being a support function to very much being on the front line working with our customers. Along the way, a few things happened, not least of which was the fact that IT changed. IT is not the IT I joined 25 years ago. IT is not the IT I saw 7 years ago when I joined Quintiles. BYOD, consumerization, social, mobile, the App Store, divisions running their own in-the-cloud applications. You know what? We're pretty passionate about all those things. We embrace them. We push hard to try to push them out. Why? Most of the time it's cheaper. Most of the time you have delighted business units. Most of the time that divide between IT and the business, it goes away. We tried BRMs, business relationship managers, doesn't work so well. Instead, we create blended teams. A story from Semio is that when Semio was initiated with our key customer, Lilly, one of the requirements was that any work that went through there, molecule design, would flow through into Quintiles if there were any services works to be performed. It took a brave executive early on to overturn that decision, given the significant monies we were putting into it, and instead to open it up. And so our customer could use the platform for anything they liked, with any service providers they liked. That was a good example of not dying in a ditch over it must come to us, because it enabled us access to a much broader range of work inside our customer's organization before we offer it to other customers. We've had a lot of good ideas inside Quintiles. The company is built on innovation. Our chairman was our founder 30 years ago, and he's a very entrepreneurial guy. But within IT, we believe our core competence is actually making others look good. And when we make them look good, generally, they say nice things about us, which is always good, but they succeed. And all of our game changers have been where we've tried to shift the idea into a business line and let the business line take it forward. Semio, what I showed you earlier, is now run by Rick Sachs, the doctor at the beginning of that video. And Rick is creating a business unit around this and taking it to market as we speak. So we passionately believe in giving our ideas away. Sure, we'll come up with some things, but give them away. Coming back to really where I started, it's all about timing. It's been all about timing at Quintiles for sure. So what worked 7 years ago is not the same thing that works for us today. 7 years ago, we were providing support. My organization's gone through 5 pretty significant reorganizations in that time. Why? Because we were chasing a goal. We knew where we were trying to get to, and we chased it hard. And over that time, the organization has evolved. It's not for everybody. I think new IT is definitely not for everybody. It's a little out there. It's not certain what it looks like when one finishes, particularly on some of these game changer type initiatives. We crossed the chasm, I would guess, in about 2008, where we stopped looking at internal efficiency and cost-driven game changers and flipped over into market game changers. And working directly with our customers enlightened us enormously. Getting into a partnership with a customer is a big undertaking. It's risky, especially if it's a key trading partner. It's not for the faint-hearted. So we've learned a lot working with our key customer here, Lilly, but working with others as well. With Semio, I would characterize a few things that are of note. We created a joint team. 3 of the 4 leads in the team that were going to build out this new capability were from either Quintiles business, Lilly business. They were not from IT. Yet they were leading technical teams. That worked really well. There was no us and them. There was no divide. We separated out the team from the respective motherships and put them into a secret location in Indianapolis. And we empowered them. And I think that the team relearned how to think creatively, how to think visually. They set up the office the way they wanted it, open plan, whiteboards everywhere. It's a bit of a cliche to describe it that way, but it worked. It was very disruptive. It challenged the norm. It challenged all the orthodoxies in both our companies about how things should be done and what things look like as an IT project unfolds. For example, we delivered production-ready code every 5 weeks, but it was go slow to go fast. 1 week of planning, followed by 4 weeks of hard coding. And it wasn't an agile methodology in terms of burn down of requirements. We didn't know what the requirements were. We were somewhat finding our way through this massive amount of medical records data to get to an endpoint. So, in summary, it was a 3-year slog to get to where we are today on Semio, and it was a lot of fun along the way, and I think that the team learned a lot. We learned a lot about how to do this. And in closing, I'd say that it worked. Our numbers are accelerating very, very nicely in the marketplace. Our customers are delighted with what we're doing. My CFO is fantastically delighted with the performance that we are bringing in of our own business, but also in terms of enabling further business wins by the firm. So I'll stop there. I hope this has been helpful, useful, and hand over to the esteemed panel if there are any questions.
Great. Thank you so much, Richard. I think we'll start with Mike this time. Yep, he's calling for it.
That was very interesting. As you now have a product, a platform out generating revenue, can you talk a little bit about the competition now? Do you have competition? Will you have competition? I mean, in most businesses where there's a company that's got something that generates value, it attracts competition. And then how do you avoid, or is it a problem for you getting sort of dragged down into that whole sort of, I've got another business and I'm competing, and does it start to drag you out of your core business that you came from? So can you talk a little bit about that?
Sure. I think as a company, we recognize that our core business is shifting. Healthcare and pharma is shifting. There's no way that whole setup is sustainable with the percentage of GDP when you look at healthcare. So standing right back, it's a big problem. Coming close in, are there any competitors? Not really. Not for the game changer that I shared this morning. There are for some of the others that we've created, and the competition has heated up quite nicely since we offered an end-to-end drug development platform last year. So people have rushed in there and said, I want a piece of this. These guys are getting ahead. A very small number of folks that I would even consider close competitors today, they will come. They will come. Our philosophy, though, is one of look to the future and look to these changes as a way to come back in on, okay, so what are the new game changes going to be? And in some way to let it go as well. We're going to partner. We're not going to build all this inside. A lot of partners involved in putting together what I described this morning. So it's not one IT group. It's actually a consortium, I think.
Great. Seth?
Yeah, I was going to ask you, Richard, how do you get involved with a project like this and not have it turn into a software company? I mean, is there a P&L that you're running?
Yes.
Does your team have to find certain profit targets? How does that change the way you look at IT?
Yeah, so I talked a little bit about the cultural change earlier through my presentation, but definitely there is a business model change here which brings a different kind of people and thinking, a different way of approaching the strategy, a different way of approaching budgeting. So my cost centers, if you like, are split, profit and loss. So I certainly have that revenue stream coming in, and then allocate some to R&D, allocate the rest to our CFO, who rubs his hands. It's a different way of thinking. We're not trying to be a software company. I think this is more a reflection of where I believe overall industry is headed. It's this, I think our customers want to buy services. They don't want to buy software. They don't want to buy all those bits that they have to string together then. So our goal is to provide those services which are enabled by some pretty meaty technologies underneath, but to mask that and have that behind the curtain, and what they buy is in front of the curtain. And that's what's worked very well, Seth, over the last year or so.
Great. Jerry?
Yeah, Richard, I'm wondering, when you started out, you were talking about the IT culture was one of basically keeping the lights on.
Yes.
Was the transformation here one of, well, the lights are on and they're steady, we can keep them on, and those resources can now go over and do this, or was it additive? Did you change your risk posture in terms of traditional IT? How did that go?
At the beginning, September 2005, it's literally next week is my 7-year anniversary, it didn't work. We were an in-sourced, outsourced mess across many different countries. Over the years, we changed that, but the whole philosophy changed along the way as well. So there was an element of bring it together, an element of churn involved with people to get the right organization in place, and changing the culture I can't emphasize enough. As you start to go after these new opportunities that were right there in front of us. They were right there, but we couldn't do anything about it. So from a company strategy perspective, I think Quintiles has always recognized the value of technology, but it's not always been straightforward to bring that through and to go and create revenue off the back of it. It had always been a backroom activity, almost a must-have and a tolerated backroom activity with a big spend. In terms of headcount, I think my headcount has gone up from well, I can tell you for sure, September 2005, I had about 6 developers and about 4 testers. That's it. Today, I have about 300, 350 developers. You get the story. So we've grown from about 300 people to 1,100 people, but it's the partners. We have a huge partner network, an ecosystem that we work with that enables us.
Great. I got time for maybe one question out there. Anybody? Back there? Chris?
Richard, that was great. You talked about the culture and the people changing. Did you go consciously out to, say, commercial software companies or to outsourcing companies or, more customer-facing organizations, IT vendor organizations, to find those kind of people, or did you look within your organizations? How did you sort out who would be right for this more customer-facing role?
That's a great question. I think we did all of the above. We certainly targeted some organizations where we felt talent lived, and talent had been developed and done very well. Service providers, IT service providers, where there's a focus around, say, life sciences, very helpful. But we did an awful lot to develop internally. We had some great people, but they were not really being used effectively or allowed to grow and given the scope in order to get things done. And the 2 gentlemen, Joe and Gavin, who's here today, are good examples of that. So we tried to do a combination of targeted hiring as well as bringing forward our own. But there's a third element to it, which is a Southern phrase, that dog don't hunt. So I turned that around a little bit and just looked for dogs that do hunt. So I got on the phone on day 2 at the company and started to call around for folks when I talk about changing the leadership, folks that I know that I can depend upon that can get things done. And they've been very, very successful in helping transform the culture. But also, talent attracts talent. So over the years, we've become a bit of a destination, which has helped us enormously get those creative individuals that we'd like to see on the payroll versus old IT. I think that's an easier one to go find.
It's a little disconcerting to hear somebody with a British accent say that dog don't hunt. But
I live in North Carolina. I live in North Carolina.
And on that, though, also, if you're doing co-creation with partners, with customers, I would imagine you need more, and not that IT people aren't this way, but more customer-friendly people as well, yeah?
You do. You also need lawyers. Beware the intellectual property discussions, which I haven't touched on at all. That probably take days. It's different. The risk profile is completely different. I think working with a key customer, particularly a key customer, you cannot afford to get yourself into a risky scenario where your back is to the wall. You can't put yourself between a rock and a hard place and die in a ditch. It really doesn't work. Customer's always right.
Great. Thank you so much.
Thank you.